Ministries of Health, Education and Sports are collaborating to tackle sexual gender-based violence among adolescents, particularly in refugee settlements and host communities. The initiative aims to address the knowledge gap, improve coordination and enhance synergies among partners to combat the vice effectively.
Sexual gender-based violence against girls, adolescents and women in refugee and host communities is a significant concern for partners, exacerbated by the stigma victims face. The Ministry of Education and Sports is intensifying efforts to address coordination gaps by refocusing on the lower secondary curriculum to include education on gender-based violence and violence against children.
We recently reviewed the lower secondary curriculum and we have a new secondary curriculum on board, which is also a policy that should be implemented in the various institutions. And this has the content to do with sexuality, education and issues of gender-based violence.
The Ministry of Health emphasized the need to implement strategies to tackle SGBV among adolescents in refugee settlements by addressing knowledge and coordination gaps.
Really need to work together as stakeholders. When we want to attain gender equality, for us we look at collaboratively working together to see that we implement strategies that are aimed at eliminating all forms of violence without also leaving out sexual gender-based violence inclusive.
Regina Bafachi, Executive Director of Action for Development, highlighted their recent project, My Right No Violence, Prevention of Sexual and Gender-Based Violence Against Women and Girls in Kyaka II Refugee Settlement and host communities in Chegegwa.
They would like to see the health care providers being sensitive to the needs of the young people. We need to see user-friendly services.
The project calls for establishment of new coordination and reporting mechanisms for cases of sexual gender-based violence.